To continue with the veterinary laboratory procedures, we are going to talk for today about the urinalysis. The method of collection should always be noted on the urinalysis requisition at the time of analysis. Free catch or the voided sample is an adequate sample for routine urinalysis, but it is not appropriate for bacterial culturing. Owners can be instructed on how to collect samples at home in a manner that still maintains adequate quality control. Here are the advantages and disadvantages of a free catch or voided sample. So this type of sample is used for routine testing. Next is the bladder expression. For collection, the animal is standing or placed in lateral recumbency and the bladder is palpated. Once it is located, gentle, steady pressure is applied to the bladder until the animal begins to urinate. This method should never be used in patients with suspected obstruction of fragile bladder due to increased risk of rupture. Third is catheterization. This varies slightly depending upon species and sex. In any case, sterility is important. For the main advantage of catheterization, the samples collected by this method in a sterile manner may be suitable for bacterial culturing. Next is cystocentesis. The patient is restrained in dorsal recumbency and the bladder is palpated. An ultrasound may also be used to visualize the bladder and help guide the needle. For female dogs and cats, the needle is inserted along the midline of the caudal abdomen. For male dogs, the needle is inserted caudal to the umbilicus, just off to the side of the sheath. One of the disadvantages of cystocentesis, once inserted, the needle is never redirected as this could cause potential damage to adjacent organs. For the sample preservation, before choosing a preservative, we have to consider the following. First, the method of sample collection used. Next, the analysis to be performed. Third, biochemical method that will be used. And lastly, the time delay between urine collection and analysis. Refrigerating a urine sample is an adequate form of preservation for up to 6 hours. Before analyzing the sample, make sure to allow it to return to room temperature first. This is important for the enzymatic reactions that occur during the chemical examination of urine. Freezing is also adequate for most chemical tests and preserves the mineral content of the urine. Next is the addition of chemical preservatives. Addition of toluene is also a means of preservation. Due to the fact that toluene is a solvent, care should be taken in choosing an appropriate container in which to preserve the urine sample. Formalin is a reducing agent, so it does interfere with the chemical analysis of substances that use this principle in their enzymatic reactions. Boric acid is an appropriate preservative for sediment analysis and with the exemption of pH in the chemical analysis. Commercial preservation tablets also provide good preservation of urine sediment, such as leukocytes, erythrocytes, CAS, and crystals. We also perform physical examination of urine in veterinary Laboratory. So we determine the volume, color, turbidity, odor, and specific gravity. All voided urine is collected and measured to determine if the quantity produced is appropriate. The pigment of the urine often correlates with the concentration of the sample, but this should still be confirmed with specific gravity reading. We examine turbidity in a clear container of a standard depth. A good choice is a urine tube or sterile red top blood collection tube. Horses and rabbits typically have turbid urine. This is due to the presence of mucus and calcium carbonate crystals. Therefore, turbid urine is considered normal in this species. Again, it is important to use standard terminology to minimize discrepancies among technicians. Measuring specific gravity requires the use of refractometer. Many commercial reagent strips have a pad allotted to measuring the specific gravity of urine sample. This method of measurement differs from the refractometer method and has some significant drawbacks that make it unreliable for the veterinary practice. Commercial examples of multi-parameter strips for chemical examination would be multi-sticks or ChemStrip. For glucose, the possible causes of false positives with the reagent strips are contamination with hydrogen peroxide, as well as other strong oxidizing agents such as chlorine. False negatives or decreased values can be seen in urine samples preserved with formalin. Bilirubin is unstable in sunlight or artificial light and should therefore be tested immediately. Delaying testing will result in false negative values. Ictotest tablets are more sensitive than reagent strips and are able to detect smaller quantities of bilirubin. The presence of ketone bodies in the urine or ketonuria is often accompanied by a fruity odor. ACE test relies on the same testing principle as the reagent strips, but it is more sensitive. The reagent strip method for blood is quite sensitive, and positive samples may appear normal in color during the physical examination. Care should be taken when using the reagent stick as not to contaminate the pH pad with the acidic buffer contained within the neighboring protein pad. The reagent strip primarily detects albumin and are less sensitive for globulins and mucoproteins. Another cause of false negative result for urobilinogen can result from the use of formalin as a preservative. Nitrites are products formed from nitrates by the actions of certain species of bacteria. Because of this, the presence of nitrites can suggest a bacterial infection, but the absence of nitrites should not rule it out. The reagent strip method for detecting leukocytes is insensitive in dogs and almost always gives a positive result for feline samples regardless of the presence of leukocytes. Before examining the sediment, we must first concentrate the sample. So this is done via centrifugation of the urine. After centrifugation, the urine will be separated into two portions, the supernatant and the sediment. Sediment stain can be a useful tool in the examination of urine. Many microscopic elements are translucent and stain can provide some color or contrast to make visualization easier. Starting this slide, kindly study the microscopic elements of the urine sediment.